honor and a pleasure to be here today along with this panel of very distinguished guests, and thank you to Melissa for inviting me, and kudos to Melissa and her team for convening this summit today. I think it's not an understatement to say that the prescription drug epidemic is the most serious law enforcement and public health issue that's facing our state today, and also the nation. New Hampshire's not an island. We're no different from other states. I've been asked to give a brief discussion on the law enforcement perspective. I'd like to make it clear that the Attorney General has made this issue one of his top priorities, and as an Assistant Attorney General, I have had the opportunity to have a front row seat and also to help lead the charge in us being part of the solution to this incredibly complex problem. Of course, the biggest challenge that law enforcement faces, and it's the same one that everyone's facing, how do you restrict the availability of prescription drugs to those people that truly need them, and only in the amount that they need, in an effort to avoid diversion, which is the problem that happens, that law enforcement is facing. Ordinary citizens with no prior criminal records who at one time were prescribed medication for legitimate illnesses or problems, often perpetrate the crimes that we see in these cases. In terms of the group collaborative, listening to everyone today, and also speaking with members of the panel, I am reminded of a famous quote by Martin Luther King Jr. He said once that we may have all come on different ships, but today we're all in the same boat. And I think that's very true of this issue. Each of us are coming from our own perspective, but today we are all in the same boat. And as we heard from Dr. Andrew, our citizens are dying. For some time now, law enforcement has been on the front line of this problem. In the last 3 years, we've seen an increase in the number of prescription pills seized on the street in undercover investigations rise by over 500%, and that only represents the investigations by the New Hampshire Attorney General's Drug Task Force. That doesn't include the number of pills that are being seized by local police departments in their drug investigations. So it is alarming trend for us. Theft. In New Hampshire, prescription drugs are diverted primarily, what we're finding is through theft, forgery, the use of counterfeit prescription pads, fraud crimes perpetrated against physicians and pharmacists and other healthcare professionals. Theft is one of the biggest sources of diversion. Theft can occur from people's homes. It's also hospitals, pharmacies, police stations, veterinary clinics, basically anywhere where controlled drugs are found. We've had cases involving employees in nursing homes, hospitals. Drugs are being diluted. Sometimes patients are being given fewer pills than what they're prescribed, and the perpetrator of the crime is pocketing the rest of them. Forgery is accomplished in a variety of low-tech ways, including pure theft of prescription pads, also photocopying of prescriptions, or simply adding a 0 or a 1 to increase the amount of pills in an otherwise legitimate prescription. We've had cases that involve persons in the medical field, nurses, calling in prescriptions for themselves or others. All of these cases are Class B felony, with the exception of some of the theft crimes, depending on the value of the pills that were taken, the amount. Sometimes it represents a misdemeanor. Doctor shopping is a big concern in New Hampshire. You've heard we don't have a prescription drug monitoring program. Doctor shoppers obtain multiple prescriptions from multiple providers in a short period of time. Researchers have determined that doctor shopping is actually an indicator, it's a risk factor for opioid overdoses. So if you have doctor shoppers, those folks are at high risk of dying. We had one case in New Hampshire that involved a woman who visited 46 medical doctors in a 2-month period in order to obtain Percocet for her own use, and another case involving an individual who visited 52 doctors. These are incredible cases where we're concerned that because we don't have a prescription drug monitoring program, that perhaps we have become a haven for drug seekers. Certainly they're aware that we do not have a prescription drug monitoring program. We are one of 2 states left, and I could be wrong, we might be the only state left. I haven't checked. I believe it's Missouri is the other state. I know they had introduced legislation. I don't know if what happened with it yet. Of course, effective enforcement is an important pillar of the state plan, and we think that it's already begun. Education, we have a drug diversion unit that is run by Trooper Mark Bodwin over at the State Police. He's here today, and he is assisted by investigator Chris Schamberger, who's a pharmacist. He's also here, they're over there. They have been doing a tremendous amount of work going around to police departments, agencies to educate law enforcement about how to approach the prescription drug investigations. They do present unique challenges. We're not just trying to keep a drug off the street. We need to figure out who the lawful possessors are and who the unlawful possessors are. That's not an easy task when you're dealing with medical relationship between patient and doctor. So they've been terrific. They're also working with State Police DARE. They go out to high schools and middle schools to educate young people about the perils of prescription drug abuse. So we think all of these are important steps to be taking to act proactively in this process. The Attorney General will continue devoting resources to this effort, and I am happy to take any questions later.